All right, well, I'm here with a familiar face, and those who have been watching this show and listening to this show know this is Leah Wilson, my wife, also attorney and executive director of Stand for Health Freedom. And we're talking about a topic that is a hot topic right now, and it's masks. And man, do I not want to talk about masks anymore, honestly. However, you're getting it, and with mandates and with orders, we're hearing like, why not just wear the damn mask? And I quote, because you hear that.
Right.
So I want to hear
That's
it.
the biggest question. Why don't you just put it on?
Just put it on. Why not just put it on? What's your problem? Why are you so selfish? So let's just jump right into it, because we're going to go through the whys behind why one would choose not to just wear, and I quote, the damn mask. It's okay for me to say that?
That's perfectly fine.
That's how it's said to us.
Right, and I think the mask issue is chasing us. You know, it's wherever we go, and we can't escape it. We can't avoid it. So we have to answer the question. We have to be prepared to answer the question. We have to be prepared whether or not we want to put a mask on.
So let me ask you this question. China, the East does it. China, they just do it. Why don't we just do it?
Just everyone wear the mask.
Everyone wear the mask.
Yeah, a lot of people want to know, why are people griping about putting the mask on when Asia's been doing it for years? I don't know how many years they're claiming, but they've been doing it for a while. And the question is, have we ever aspired to be ruled like an Eastern country? You know, our pride in the United States has always been that we have a say in how things go, and that we are free to move about society in a way that fits our deeply held beliefs, in a way that we agree with, that doesn't violate ourselves, our body, and that we're not ruled, we're governed. So that's why are we looking to an Eastern country to say, why not just put it on? And secondly, it's kind of comparing apples to oranges, because the reason that Asia and a highly populated areas wear masks on a daily basis is because of smog. It's because of really poor air quality, and so they're trying to protect the toxicants that they're breathing in. Whereas here we're talking about a virus. And I don't know how effective their masks are for smog, but I know they see a lot of deaths for poor air quality.
Listen, if you choose to wear a mask, it's your choice, and there's no
judgment.
No judgment. You might have somebody at home that you really, you've told them you're only going to come out, and I've heard this quite a bit. You're only going to come out if you're wearing a mask.
And if you're comfortable with that, great.
That's fine. If there's someone at home you feel like, hey, I'm doing this for them, even if it's just signaling to them, and that's the way I can go out and get my groceries or come, to the chiropractor, whatever it is. Like that's your choice. That's understand. But let's not discriminate, and let's not shame those who don't. There's a study, because it can be harmful to yourself, and this is something that's very rarely talked about, but the harm that is done by wearing that long term. So there's a study, 53 surgeons showed that masks significantly reduce blood oxygen levels, creating a scenario that can lead to hypoxia. Okay, so hypoxia inhibits T lymphocytes. That's the main immune system cells used to fight viral infections. So wearing a mask could actually increase your chance of contracting a virus, and let's say COVID-19.
Right. And so if it increases infection rates and increases chance of contracting a virus, then it's an actual choice whether or not you put on the mask. And they're saying, well, we're not asking you to wear it for 20 hours a day, just for the 20 minutes you're in the grocery store. But that even affecting your oxygen levels for that amount of time has been shown that your oxygen levels can decrease. It can contribute to dizziness and headaches. Mm-hmm. And someone who's very aware of what's going on in their body, those things, A, don't take long, and B, lifestyle medicine instead of external interventions are habitual. And it's something that each decision builds on itself. Your oxygen levels are one of the foundations of life. And so it's not superfluous or silly to care that you have proper oxygen.
Those who are in tune with their bodies feel when they put on a mask that it's not right. There's not good oxygen exchange there. Mm-hmm. Personally, I saw someone pass out while wearing a mask, and she couldn't explain what had happened. She literally fell over, like as she's walking up a ramp, she falls over backwards. we've also seen, you and I have both seen this, but I just recently saw this in a restaurant where this person was, she was just sweating. She's literally panting, and she's like, you could literally see that as she's inhaling and exhaling, sucking the mask in. And I said, hey, take a break, just pull it off for a second. She's like, oh my God, thank God. I don't know what's going on. I'm having like asthma-like symptoms, and she's now panicking. She's got anxiety. So there are harmful effects of wearing a mask. We know that to some people. And it might not be a one size fits all. Like, you might wear one and be just okay for yourself, or you feel like you're okay for yourself, or whatever that is, but it's still your choice. But it goes back to, does your decision to not wear a mask put me at risk? Does it put me at risk? Are you a asymptomatic carrier? How would you ever know if you are one?
And that's the big question, because no one wants to hear about you saying, oh, it's my choice to wear a mask, if it's perceived that it affects the people around you. Mm-hmm. So the big thing is, hey, your rights end where the harm to me begins. Mm-hmm. And that's a huge philosophical question, and I don't think that anyone wants to argue that we want our rights to extend into a space that harms our neighbor. However, in order to justify even touching someone's rights of how they care for themselves, this has to make sense. Mm-hmm. It has to make sense that it's effective filtration, that's not more harm to the individual than it is a benefit. And so you can look at all the laws you want to, constitutional laws saying, well, public health extends into the interference of your rights because it's for the public good. But you can't just say that and not also be able to show that it makes sense to do it. Mm-hmm. That the mask is the answer. That the mask is what is going to allow us to keep our businesses open. So really, we're missing a huge step there. And that step is, we need to know that the mask is effective and makes sense and is not doing more harm than good.
It's interesting that we have this conversation of asymptomatic carriers and how people are concerned about asymptomatic carriers, whereas they were never concerned about asymptomatic carriers when they injected their children or gave them vaccines for live viruses and then sent them to school as asymptomatic carriers.
For 3 weeks plus, when you're talking about chickenpox or measles or those sort of vaccines.
So now all of a sudden it's those who are not doing that as, a threat to those who are. It's a very similar story when it comes to how this parallels just even the vaccine debate. And you can even see how this is going to go into that. Here come, let's say, the fall, and now the second wave or third wave or the new virus or whatever that is. In my mind, at what point does this stop? At what point do we need to, or should we consider asking some questions about how far are we willing to let this go? And at some point, there's a concerted effort or an intentional stand that has to take place. We know that it can be harmful for the individual to wear them. That's why you don't see us wearing them. We know that it doesn't actually spread or limit the spread of disease. We also know that constitutionally that this is a very slippery slope.
Right.
And so the question is, why don't you just put on the mask? Well, I would say it's a layered answer. There's a lot of reasons why we don't just put on the mask. It's a very personal and should remain a personal decision.
And it comes down to, are you complying with something that makes sense, or something that you can't put the pieces together to even understand why you would do it? And there's all of these exceptions to any of the mandates we're seeing come down. Thankfully, there's lots of exceptions, and those exceptions include things like health-related reasons, mm-hmm. or medical reasons, or psychological reasons. There are a lot of people that it puts them into a panic, or they start to become very uncomfortable that A, they can't get proper oxygen, or B, they can't communicate with the people around them. And that's even an exception too. If it's something that prohibits you from effectively communicating, if you have hearing issues, if you have speech issues, that it can be an inhibition for all those types of things.
Planes not taking off because one person doesn't have their mask on. Literally, pilots stepping out of the cockpit, walking into the aisles and saying, You need to put on a mask or go back to the back of the plane. Everyone else is already sitting down. Just the public shame that would exist there. This is real life. This is happening. Literally other citizens tracking people down, yelling at them in their face. Groups of people surrounding them, like yelling at them. Just because that one person, for whatever reason, chose not to wear a mask.
And we don't know what that reason is. And to have a snap judgment based on someone's outward appearance, since when is that something that we want to accept?
So I think it's important to just, not discriminate here, whether you choose to or not to. The reality is that there is a choice in the matter, or is there? Is there really a choice in the matter? It's been mandated at this point. Is there a choice? And then if there is a choice, why don't you just put on the mask?
One of the things we have to recognize is I don't think we should ever give up our choice in saying, oh, we have to be law-abiding citizens, we have to abide by the law. Well, these mandates, A, aren't laws. That's not what they're considered. And B, when has America ever sat down and accepted things that they view as less than moral, less than ethical, or out of alignment with our values? And you say, well, why would you care about, why not just put on the mask? Like, why are we even talking about this? Why is it a topic to be talked about? But all in all, just the short answer is the mask doesn't make sense, and I'm not going to play along with something that doesn't make sense and perpetuates fear for pharmaceutical industry's benefit. And that's a big answer, and we can flesh out exactly what all that means, but all in all, it doesn't make sense, and I'm not going to play along with something that doesn't make sense. If I truly thought that it was a benefit or found any evidence that it was a benefit to my neighbor and then to me, then we could have a different conversation.
So where there's lots of information, maybe even misinformation out there on this topic, you mentioned something that I think is very important, because we could go through the science that supports and the science that contradicts.
Right, exactly. We can talk about law and science all day long.
We really could, and we could beat our heads against a wall talking about this and really have a healthy debate going back and forth on the science, because you have epidemiologists on one side who say to do it, and epidemiologists on the other side who say don't do it. You have medical doctors who say do and then don't. You get on both sides. What I think the conversation really needs to go to, though, is what you just touched on, is who's benefiting from this? Mm-hmm. Who's profiting from me wearing a mask? And you just mentioned that when you mentioned the pharmaceutical companies, but let's dig in there a little bit. What do you mean by that?
And call out the elephant in the room. This can sound conspiracy really fast when you're just saying, oh, well, pharma will benefit. And it's like, oh, man, now here we go. But the thing...
Well, hang on a second. Is that really a conspiracy? Okay, so if I own a patent, I own the drug solution, I do that. Nick Wilson does. And then I also set the rules, and then I also own the government agencies. I have my hands in that. I also have my hands in the media. I pay the media the absolute most for marketing. Out of any of their marketing sponsors, I pay them the most. Is that really a conspiracy to say or even question the ulterior motives that exist there, or conflicting interests?
Right. Conflicts of interest are real, and all adults know, and even I feel like even my 8-year-old knows, follow the money. If someone stands to make money on something, money talks. Money speaks. It's human nature. If someone stands to benefit, we have to know who are our experts that we're listening to, where is our information coming from, and this message of just put on the dang mask is so pervasive, but guess what? So is the industry control. This big tech, pharma, government tie has become ominous. It's extremely vast. And you say, well, our government leaders are telling us this. Well, there's 2 pharmaceutical lobbyists assigned to every elected government official. So who's talking to them? Well, CNN and NBC and CBS are recommending this.
And Fox and everyone else.
It's an election year, and how much of their dollars come from the pharmaceutical industry? I think it's above 80% in an election year, and 70% in an off-election year, if I'm getting those numbers right. But it's a lion's share of money is going to the people who are doing the talking right now, directly from industry. And it's like, well, why does the industry care if we wear a mask? It's not a drug. It's not FDA approved, which that is a whole nother point. But the New England Journal of Medicine and JAMA have both said in the last 6 weeks, because I follow these journals just to see what's happening in the landscape, and they've both said in the last 6 weeks that getting the vaccine to market is one thing, but getting people to take it is the bigger thing. And so they recognize if we don't keep people on their toes, and if we don't keep people aware of the immediate threat to them and their family, then we will not have an uptake on this vaccine that we stand to make over $300 billion annually on.
And what are they making right now on vaccines?
$60 billion annually is the estimated value of the vaccine industry.
So we're talking a 5-fold increase on their, let's just call it income or return on investment.
Return on investment is different, but even that's a different thing. When you look at people who have pharmaceutical investments and they say that it's 16 to 1 or 20 to 1 return, which is unheard of in the investment world. So why wouldn't you push for those investments to do the best?
So what I hear you saying is that the mask, so bring this back to like the mask decision, perhaps the mask or continuously wearing of the mask is helping us to keep COVID on the forefront of our minds when it otherwise might not be.
It perpetuates, and this is what has been said by the CDC and by others, that it makes people keenly aware of mass transmission and mass death. But where are the numbers to show the mass transmission and to show the mass death without the image of the masks?
So here recently, we've heard this spike in coronavirus cases. Yet, we're not talking about the deaths anymore. It seems like the deaths have really fallen off the radar. And now people are admitting, yes, it's not nearly as deadly as we initially predicted.
And it's become, so I think people recognize this, but it's also become kind of a joke, which I don't know how funny it is when it's affecting how we can educate our children, how we can make a living, how I can go to the grocery store to feed my family, when it's affecting how we can literally move about life and even host a barbecue in our backyard if there's 5 or more people. When your life is affected to that extent, I'm not sure how funny it is. However, there's jokes being made, well, I can go to 5 different testing sites today and it will be submitted as 5 different tests. 3 of them might be positive and 2 of them might be negative. Mm-hmm. And friends and family are talking about that. That's not just a one-off experience that was covered in the New York Times. This is literally what's happening around the nation, and friends and family are laughing about it, where they're not talking about the deaths anymore. They're talking about the cases. Mm-hmm. And where are we getting these case numbers? It's from a huge increase in testing. Mm-hmm. So what does it even mean to have a positive case of coronavirus?
Mm-hmm. Well, and so initially it was estimated like 4% death rate.
Ferguson, right? That's the original models said it would be around 4%, which would be very devastating. If you look at a global virus, 4% of 7 point whatever billion, that would be very devastating.
And right now it's at 0.1 to 0.26 is the estimate, correct? Is my number still right?
0.26% is the estimate in the U.S., which we are one of the worst rates. Which, surprise, we have the worst infant mortality, the worst maternal mortality, highest chronic disease levels. And so we're not surprised that the coronavirus did affect us more than some other countries. So we're at 0.26%. Mm-hmm. And when you look at that, really that upper tier, which is what that is because it represents the U.S., and then if you look at that range, it's specific age ranges, which are normally above 60 to 70. And then when you get down into below that age range, it's as low as 0.07% or 0.1%.
And as cases continue to rise, which they will, the more people you test, the more people you'll find. And the death rates continue to stabilize or go down, which they've gone down over the last 2 months. What does that mean? That it is perhaps maybe contagious, but not as deadly as what they initially predicted.
Or infectious. Right.
So that's one thing I want you to explain here. What do you mean by not as infectious?
So the whole germ theory, which that's a whole nother question of putting on the dang mask.
Hey, we did an episode on that.
Right, if you subscribe to the germ theory. But the whole
If
germ.
you subscribe to our podcast, you can listen to the Germ Theory.
Okay, so the infectious idea is if we have a specific virus that we're looking at, in this case COVID-19, have we isolated that to know, is it replicating and transmitting? Is that the actual thing that's being passed? Or do we just have the virus? Because we know the microbial world is vast. We can't even count it, And so when you test someone to see the presence of COVID-19, that's what you're testing, is for the presence of COVID-19. And there are specific tests that will test for the threshold, like how concentrated is that presence to know perhaps it's replicating in the body and you're actually infected with COVID-19. And so which one of these tests are testing for infection and which for the presence of, and on the death certificates, which are thankfully plummeting, what is it signifying? Is it signifying this person had presence of COVID-19 or that it was the actual infectious agent that took their life? And that's a big question right now. It's a big question in the body of scientific research around COVID-19.
Well, it flies in the face of asymptomatic carriers. As asymptomatic carriers being the spread of the virus. Being the fact that infection, so in order for you to spread it, you have to be infected with it.
It has to be replicating in your
It's
body.
not like it just sits on your skin or in your nostrils and
hops out.
And it just hops right out. It goes into you. That's not how it works. In fact, that even the other side, the pro-mask, pro-vaccine, just that whole, they even say it's not like the virus gets spit out of one person's mouth and goes directly into your system. They even say you have to be you would have to be in contact with people for minutes at a time, even
longer.
Up to 30 minutes. Like there's been, and in close proximity, and so there's a lot of caveats to you becoming infected. It's not a simple passing in the grocery store,
right,
and then you just happen to sneeze on whatever it is. And
in
fact,
that's the perception with the masks, is that I am a danger to anyone else in the room, and that I am a danger to the cashier if I'm making a transaction, but
it's not just you, it's the 125 of you who pass that cashier. That's the argument.
Correct. And the mask perpetuates that idea, even though we know that there's not science to show it.
Not only does the science not show it, but it deeply violates, and this is my opinion here, it deeply violates a philosophical understanding of the body, of how you take care of yourself, that your health is your responsibility. And also, we say this is a mandate, it's a law. Is this really a law? Is it law?
Well, that's a good question. I mean, that can be dug into. I have to give you the correct answer because that can be dug into in any given jurisdiction, any city, any state. What authority does this person actually have under emergency provisions? But the consensus is that no, these emergency provisions are not enforceable under the law.
Bringing back to the question, okay, I understand some of the points, but come on, why not just put on the mask? Why not just put on the mask? There is a lot of science that shows not only is it not effective, but it can be harmful.
Yes.
So I know that masks block 0.3, the best masks block 0.3 microns. Well, the coronavirus is 0.125 microns.
So the filtration has been shown to be highly ineffective.
It's like putting up a chain link fence around your house to protect your house against mosquitoes. It's like telling your kids not to pee in the pool or telling your kids it's okay to pee in the pool because they've got their swim trunks on. I mean, come on.
So you say, okay, so it's not effective, but still, why not just put it on? Because your neighbor might think it's effective and it might make them more comfortable. But it also not only is not effective, but it can be a detriment.
Well, it can be a detriment. So, okay, think about this. We deal with a lot of people who have, let's say, mold exposure, and that would be absolutely detrimental to breathe into something. And then also just that harbors infection, and it can harbor infection there. And so it's a breeding grounds for germs. So then also, no one wears their masks properly. We know that. And it's what's interesting is that it seems to be very okay to improperly wear your mask, which would also spread this even more than if you didn't have a mask on to begin with, than not wearing one at all, which is actually going to be safer for the spread of disease than someone who's actually wearing it improperly and then throwing it in the trash can. And then now that trash can is just sitting there with everything you just breathed into it. If you were, let's say, an asymptomatic carrier and you didn't know it and you just did that and threw it in the trash can, well, boom, now that trash can there sits for however long as a vector of contagion. It just doesn't make sense what it comes down to. And there's more to it. How about all the trials and the studies that are showing that it's not actually effective?
Right. And so going back to the whole concentration of the virus is what causes us to become infected, and then we can be a transmitter. If you have a mask, so if we say, okay, what God gave us are ears, eyes, nose, whatever, mouth, are ineffective filtration. So we need this man-made filtration in order to protect all of us. Well, what we're actually doing is we're putting on a filtration device that's ineffective that is accumulating. So if there is bacteria or viruses or moisture there, and that it can accumulate and grow and become a greater and greater concentration, which the studies show that increases influenza-like infection in people who wear a cloth mask. And so if we're increasing influenza-like infection in mask wearers, then the transmission will be greater.
Hearing impaired, those with anxiety, I feel bad for those who have depression right now. Like, this is
the isolation. It's very isolating not to be able to connect with the key facial features of a human.
Those with drug and alcohol problems, right? Just the connection that they had with their brothers and sisters and family, and now they don't have it. And so just an understanding of, hey, it's not all about you. It's not all about me either. It's not about the collective greater good. It's an individual choice, and there's a backstory behind that, and we need to respect that backstory, whatever that might be. But if this creates massive anxiety and now dependence on anxiety drugs, or it creates a problem with their respiratory system, that is their health, their body, and their decision.
And the healthier they are, the better off we all are. Because you can't say, I would like you as an individual to compromise your health for me, and then think that the whole will be healthier. Because if we have 20 people that make up a group, and we want each of them to sacrifice a part of themselves for the whole group, that group just now notched down in their ability to thrive and their ability to contribute to society. And it's common sense that the healthier I am as a part of the whole, the healthier the whole is. And so health is a personal responsibility. And however you see fit to pursue health and to be the strongest contributing member of society that you can be, as a parent, as a business owner, as a leader in your church, whatever that is. But making sure that you are the healthiest and wholest version of yourself is the best thing that you can do for yourself, your family, and your society.
What's good for the individual is good for the whole.
That's so much easier said. That's right.
If it's bad for you as an individual, it's bad for the whole. If it could be harmful to you, there's no chance that it should be mandated. Again, you can see the parallels with the upcoming COVID-19 vaccine that eventually comes to market. You're going to see the parallels here. But the shaming of those who choose to or not to put on a mask has got to be stopped.
It has to be stopped because you see people want to be accepted by their peers. People want to be accepted by those they walk around with. And so what we're seeing now is asthma patients, even young asthma patients, 10-year-olds, 12-year-olds, they want to fit in, so they'll put the mask on even though it is an instant detriment to them and to their lung capacity and to their oxygen levels and then to their brain and thoughts. And so what's happening with this extreme social pressure is that people are knowingly harming themselves just so they don't stand out and get heckled.
At what point do we say enough is enough and say, wait a second, I'm not going to go along with the collective here? That's a hard decision to make, but it is a very personal decision and something that you have to decide if that's something that you want to do yourself or not to do yourself. But when it comes to masks, There's real choices that can be made, but it is an absolute choice. And there's exemptions for those who, even within the mandates, you can see exemptions, but it's no one's right to ask questions of why they're choosing not to and what exemptions they personally have, whether it's their medical reasons or whatever else they might be not doing that for. It's no one's right to inquire about that. It's your choice, and realize there's rights and there's exemptions and there's personal choice involved.
And we don't need our neighbors to support our well-being, and we don't need the government, and we don't need laws to support our ability to pursue well-being and to abandon fear over what our health outcomes will be.
That's exactly right. So really, to wrap this up, let's not judge. Let's take common sense measures when it comes to building health. My goodness, how far have we gotten from just this conversation of build your health? Health is your greatest asset. It's your responsibility. Healthy people in general don't even get this. And so build your health. Build your health. Strengthen your immune system. Do things necessary. There's still lines out the door when it comes to fast food restaurants. Mm-hmm. There's still people smoking. No one's going around knocking the cigarettes out of people's hands right now. That's secondhand smoke.
Or taking their processed food out of the cart.
I mean, let's get back to common sense measures when it comes to health. Public health in general, when you study public health, it's really never been about the individual. It's always about the collective greater good. Hey, maybe it's time to throw out some of the old ideologies when it comes to public health and the germ theory of disease, and it's really good that people are starting to question this.
That's right. And just remembering that there is better for us, that we can pursue well-being, and that we do not have to walk in fear.